joining us. Welcome to the second webinar of the Center's Winter Educational Series. Today's session is focused on selecting measures and indicators. My name is Vanessa Pleasance, and I'm the Project Officer on our Evaluation and Research team here at the Center of Excellence for Child and Youth Mental Health. Today's webinar has 29 people registered from across the province. Before we get started, we'll quickly go over a couple of housekeeping items and introduce today's presenters. We're recording today's webinar, and it will be archived along with PDF versions of the PowerPoint slides on the Center's website. We suggest logging into the audio portion using a phone, as this is the best sound quality. If you have any technical issues, please note that I'm online throughout the webinar to assist, so feel free to write me in the questions box and we'll sort any difficulties together. After the webinar finishes, you'll receive an email from me with a link to an evaluation survey. If you could take a couple of minutes to fill out the survey and let us know your thoughts, it'd be greatly appreciated. We take all feedback into consideration for creating and improving our webinars. We have some time at the end of our hour today for a question and answer period. However, our presenters are open to asking questions as we move through the material. So please feel free to submit questions at any point. You can either type your question in the questions box, which is located on the control panel on the right-hand side of your screen, and I can ask the question out loud on your behalf, or you can use the raise your hand function on your control panel and we can unmute you so you can ask your question verbally. Your presenters today are Kyle Ferguson, a research assistant with the Center's Evaluation Support Services team, and we're pleased to introduce Raluca Bejan, a PhD candidate at the University of Toronto and a researcher at Youth Assisting Youth. We want to give a brief introduction to the Center for those of you that may be new. The Center strives to strengthen frontline service outcomes by helping Ontario child and youth mental health agencies use evidence to provide the best possible care. Guided by our three strategic goals, learning, collaboration, and leadership, we provide a diverse collection of tools, services, programs, and training that support individuals and organizations as they find, use, and share knowledge to promote the best possible mental health and well-being for all children and youth. We're going to be focusing on three aspects today. The first is to share a process for identifying, accessing, and selecting indicators and measures. Next is to provide you with some key features to look for. And third, to offer real-life experiences through an example from the field. I'll pass it over to Kyle to begin.
All right, thanks, Vanessa. So measures, indicators, where do we start? Well, I'll start off with an example, so something simple. So let's say I wanted to know whether or not I should go skiing tomorrow. Nice, simple question. So if I'm trying to answer that question, I might think of three things. I might want to consider what the weather will be like. I might want to consider, has there been any snowfall? Or I might want to consider what types of trails are open. Now, when I'm looking at each of these, I would want to consider a few things. So if I'm looking at the weather, I might want to know what's the temperature going to be tomorrow, or I might want to know what's the wind going to be like. If I were to consider snowfall, I might want to look at how much snow has fallen overnight. And I might want to consider the type of snow. So is it wet and heavy snow, like for making snowmen, or is it light and fluffy snow, like for making snow angels? A third point I could look at when it comes to trails is what type of trails are open. Is it the easy and difficult ones that are open, or is it the intermediate and expert ones that are open? Or I could also look at the number of trails that are open, so how many are open today. So that's one way I could sort of look at a few things to answer my question. Now, what would this have to do with evaluation? Well, if I step back and look at what I'm considering here, when I'm looking at weather, snowfall, and trails, I might consider those to be my indicators. So by looking at these, I have an indicator that's just simply something that could answer our evaluation question or a piece of information. And when I'm looking over to the right side at all of these ways of describing that, I would have my measures. So simply a way in which I quantify or qualify. How can I look at this indicator and give it some sort of a value that I can determine good or bad? So that was a sort of non-evaluation example, but I like it because it was simple and we can conceptualize it. So if you're trying to determine how to come up with your measures and indicators, there's a nice little 4-step process that you can go through. The first thing we would want to do is consider your evaluation questions. So when we're thinking about our questions, we might have a process-related question. So maybe we want to know, as we've been running the program, what are some of our strengths or what were some of our weaknesses during this last edition of the program. Or we could consider our outcome indicators. So is anybody better off as a result of our program, or were there any surprises as a result of our program? Those are the various types of questions we could be asking. From there, we would want to consider what indicator we would need. So I like this quotation by Mark Friedman, who's written some books on performance measurement, and describes an indicator quite simply as how would we recognize this result if we fell over it. So what would be very obvious that this is a result. So if I'm considering my Skewed example, I have all my different units and metrics for all the measures I had. And I would look at, say, okay, so if it's minus 10 degrees, maybe less than 15 km/h winds, any snowfall at all, ideally light and fluffy. The more advanced trails are open and there's more than 4 of them, that'd be a good day to go. Another thing to consider is maybe what would a bad result look like. So here we see that it's much colder, much windier, no snow, and sort of easier, non-interesting terrain. And it's just something to keep in mind, because often we'll find that a good and bad result are just the opposite of one another, but it's important to just ask yourself, is that the case, or would what seems to be a good result be an ambiguous result? So just ask yourself that first. Moving on to source of information. So this is really sort of endless here. You can come up with all sorts of different sources, but primarily we focus on a few here. So we could start with administrative files or client records or something that we can archive and look over. We could conduct a focus group with either our program staff, some of our past participants, maybe parents of children in the program, other stakeholders in the community, just to bring everyone together and have a discussion. We could also use an observation technique, maybe not quite as intrusive as this one here, but just walking around taking a look. Often after events, the first thing I'll think of, oh, did everybody appear to be having a good time? And you can sort of use that to frame where you would look from there. Additionally, there are surveys, and there are, again, a countless number of ways you can do these. I've just picked a few to focus on. So we have the good old-fashioned pencil and paper. They're easy to distribute when you're in a room. We have telephone-administered surveys, so they're great for reaching people when you can't see them in person but would like to ask them some questions. You can do so over the phone. Or we have computer or web-administered surveys. There we go. Computer or web-administered surveys, and these are really picking up in the field. There are all sorts of advances you can do here. You can get them programmed into apps that people can fill out on tablets and smartphones. Just keep in mind, though, that is internet connection going to be a problem? Is that something that's available, or should we go with maybe a pencil and paper? So just be aware of what you would need and what your survey takers would need in order to complete these. And finally, we move down the chart to types of data. And when you boil it all down, there are essentially 2 main types of data you can have. You either have your quantitative data, which is anything from z-scores, ratios, percentages, scale score, means, deviations, basically anything you can put into a number form. And alternatively, you have your qualitative data. So these could be anything from case notes, it could be comments and suggestions, feedback. I've had some good luck using participant journals as a really rich source of information, and this is where you find that really valuable descriptive data that you can't necessarily capture by a set of numbers or a scaled score. You get that sort of deeper response from people. So I want to move away from just measures or measurement as a topic and focus just on sort of psychometric measures or surveys or questionnaires specifically that we might use in our program rather than just measurement as a whole. And the two main things we want to consider when we're looking at a psychometric measure is the idea of reliability and validity. So reliability, quite simply being, is our measure, can we depend on it to produce consistent scores? And validity is primarily concerned with legitimacy. So is this a legitimate use of a measure? Unlike old Betsy here, who is not reliable, and unlike phrenology here, which is not a very legitimate way of determining personality. So when we're looking at reliability, you'll generally see three main ones that are often reported. The first one is inter-rater reliability, and that just deals with if I have two, why is that not working for me? Ah, there we go. So if I have two people who are using the same measure on the same person, to what extent are their scores similar? So I would look at how consistent those are to ensure that they're not too different from one another. For test-retest reliability, what we would look at is if I give the same measure to the same person over a different period of time, how consistent are their scores on it at time A and at time B. Internal consistency is sort of the more theoretical one, so I'd be concerned with if I'm looking at a topic like employee stress, for example, and I wanted to ask 3 questions that were all related to employee stress. What internal consistency would look at is how close are the scores across the same 3 questions to one another. So if a test taker answered high for question 1, indicating a high level of stress, I would expect them to have a similarly high answer on the second and third questions that are all relating to employee stress. So those are the 3 main types of validity you'll see about, but now that we know what they are, what does it mean? How do I know if it's good or bad? So what you want to look for is generally when you see reliability reported, you'll see it as either an alpha or a kappa score of 0.2 decimal places. And generally what you'll want to look for is anything above 0.70 is considered to be fair or acceptable for usage, getting to good and excellent as you get higher up the, as you get to a higher ratio. Don't be too alarmed if you don't see one or a value of 1.0. You generally won't see those, and that's for reasons that are beyond the scope of this webinar, but I just wanted to put out there that don't be alarmed if you're not seeing values that high. And again, this is just a target to sort of plan your evaluation, but also keep in mind the severity of the decision you're trying to make, or what are we using this measure for, and how strong of a reliability do we want for it. So moving to validity, it's a bit more complicated than reliability in that there's not just a number to look for. Validity is usually concerned with usually 3 things about the validity of the measure itself, the use of the measure, or the conclusions we derive from the measure. I'm going to focus on the use of the measure itself for this webinar, just because I feel that's one that's more useful in an applied setting rather than the measure itself, which is a lot more theoretical and research-based. So what I've been able to find is an example from McDowell and colleagues who give 17 questions to ask about generalizability or using a measure in different settings. And these are all good questions. If I were to focus on maybe 5 of them, I might look at in which population was the tool originally developed, so who was it meant to be used for. I might look at, has it been used in the group that I'm looking to use it for, or similar groups. I might consider, is it a general measure or is it specific to a condition? This list is from the medical world, so that's why it's disease specific. I'll say condition specific instead. I might look at in what ways has the tool been validated. So it's great that it's been used in the population that I'm using it in. What did they actually say about it? Did they say I should use it or I shouldn't use it? What information do I get from that? Or I might also focus on, is the original purpose of the tool appropriate for use in my study? And going through these questions, I sort of answer that sort of, is it legitimate for use in my program? And this is just a rough guide that can help you answer some of those questions. So that's moving on from reliability and validity. The next sort of property we want to look at is feasibility. So if I'm looking at it, I want to consider it in terms of 4 different types of demands. I want to look at it in terms of my staff demands, so workload, time, training, all those sort of things. What skills do they need? I would look at the measure in terms of time demands. So does it take a lot of time for staff, admin staff, clients, children, their parents? What sort of demands does it have in regard to time? I would look at the cost demands, and that's just not the actual price of the measure itself. It includes, do we need software to go with it? Do we need to train people to use it? All the different costs that go into building a measure. And then the 4th sort of set of demands are the data demands. So what about data entry? What about analysis, cleanup? Does it give me usable data? What format does it come in? All those sort of different demands. And one way that I've found helpful to try and rank order these is to picture them in the form of a chart. And I used this one here where I sort of set up these 4 demands and just come up with a way to rank them from from low demand to high demand. And the whole idea is to just give myself a visual picture of how these go. So if I'm looking at measure 1, I can see that there are high demands on my staff and high demands on time, medium cost and medium low data demands, so okay. And if I compare it to measure 2, I see that there are much lower staff and time demands, a bit lower data demands, but the cost is a higher demand. So I can consider these this way. And that's, again, just to reinforce that these 4 sort of demands don't exist independent of one another. They're all sort of tied to one another, so I can see how each affects the other. The next one I'll move on to is relevance, and this one is quite simply when I'm looking at my program as a whole. Once I've decided which measure I'm going to use, where does this measure fit into my program? Does it help me answer questions in just one area? Does it help me in other aspects of the program? Can I use it in other areas? Or if I have to think and pause about where this would fit in my program, does it really give me that information? I might have to start asking, is it really all that relevant? Another way to consider relevance, if we want to look at in terms of a program, is if I go back to my skiing example, and I was looking at my weather identifier. So I selected, I was going to use temperature and wind speed. Well, I could have used, say, air pressure as a measure. I could have used a barometer, perhaps. It's a measure that's reliable. Maybe not this one in particular, but it's a fairly reliable one. It's valid. It's been around for years. It's certainly feasible. You can get smartphone apps these days that have air pressure indicators. So I've met the first 2, reliable, valid, and feasible. But when I get to relevance, it doesn't really give me any information that's useful in the context of how I want to use it. I'm really looking to see if it's going to be cold, if there's going to be wind chill. Air pressure is nice to know, but it doesn't give me that usable information for what I need. Now, there are a few other considerations that I don't want this to be limited to. And these are by no means after the point considerations, because sometimes these can trump all of the previous ones. So we want to consider based on age, education, cultural responsiveness and relevance is a big one these days. You really want to make sure that's relevant to the people that you're going to be using it with. If you have different backgrounds or different religious groups or cultural groups, those demands would usually come first and foremost. So just to sum up what we were looking at, we want a measure that's reliable and valid. We want one that's feasible. We want it to be relevant, and it needs to meet any other conditions that we have for it. Sometimes a nice table can help to summarize all of this, and this basically just puts in a table form what we've just covered, where I can compare maybe 2 measures or 3 side by side and sort of look at them all at once. And then, not forgetting the big picture, we have our evaluation framework, and we have where our indicators and where our data collection tools or our measures fit in. And this is where it comes in as a whole for our program. And these guides are both available in the supplementary materials document provided, along with all kinds of other useful stuff that we've talked about in this webinar. So before I turn it over to Raluca, I just want to take a quick moment to go through one place that you can certainly look for these measures, and that's the Center of Excellence's measures database. It started off as a way to track measures that were being used by our program grant recipients and sort of build on that to help share with others who are doing similar programs what measures have been used. It's grown quite substantially from there, and it can be accessed on the center website through here. So I'll just go to that and bring up the home page where we can see it. So if you don't have the direct link, you can find it just by going to the center's resource hub. And then you can find all kinds of helpful stuff here, like past webinars, different learning modules and toolkits, but we want the measures database. And right on the home page, we can see that there's all kinds of helpful stuff here. So we include some guides, some descriptions, and when we're looking at measures, we can list them all alphabetically or by domain. We specifically single out ones that are only available or that are available in French. Or if you know the name of your measure, we can just jump right to it or pick some specific population parameters or just search by keywords. If we list them all alphabetically, we see that there are 462 measures currently. We can see which ones have PDFs attached to them. And if we just click and open up a profile, what we'll see is first some general information. So basically who developed it and when, who it should be used with, what they like to use it for, what languages the measure is available in. We see some structure and administration information, so who's going to be administering it, who is it administered to, if you need qualifications or training to use the measure. We move down to our norms and reliability and validity, so who it was originally developed with, some of our reliability numbers. We can see our internal consistency, our test retest, and our inter-rater. We see they're all above 0.7, so it looks like a good measure for now. And different information about availability. This one's in the public domain, it's free, and we list some author contact information. So I'm going to pass things over to Raluca, who is going to tell us all about their program at Youth Assisting Use and walk through how they came up with some of their measures and indicators. Raluca?
Yeah, hi everyone. So as Kyle was saying, my name is Raluca Bejan, and I have been a researcher with Youth Assisting Youth for 2 years right now. I am a PhD student in the social work department at University of Toronto. So basically, I have been with Youth Assisting Youth for the planning stage of the grant and also for the so-called doing stage of the grant. And this presentation mainly focuses on what we have done within the last year, so in the doing phase, but I will also make references here and there on the initial phase. I just want to make sure. Okay, so it seems like I can. Okay, so for those who don't know, Youth Assisting Youth is based in Toronto. We are a nonprofit organization, and basically we provide a peer mentoring service. how this service is different than any other mentoring services is that we are actually matching youth more with their peers. So it's not a very, I mean, well, how is it different from, let's say, Big Brothers and Big Sister, is that you don't necessarily have an adult who's the main figure, like the main model, but you have someone that's sort of closer to the youth, more like a peer. And how we look at the program is we conceptualize it as being grounded within a risk and resiliency prevention framework. So the idea is we are really trying to draw on the resilience elements as a coping mechanism of youth, but we're also realizing that, even in order to talk about resilience, we have to admit that there is a risk factor of this youth. And what we have done within the doing evaluation grant phase, we have done a pre and post test design comparison to explore if the peer project fosters youth resiliency or not. I just want to make sure if slides are being able to be okay. So basically, okay, so the purpose of this project was threefold. We wanted to explore, as I said before, we wanted to see if the Youth Assisting Youth Mentoring Program fosters youth resiliency. We also wanted to see mentees' degrees of resiliency, and we wanted to create a preliminary knowledge base to inform the future development of the program. So these were our main three goals. So just to give you a little bit of a background on the peer mentoring service that Youth Assisting Youth is providing, we have served more than 30,000 young people since 1976, and currently we are servicing an average of 1,500 children a month. So the way it works, we are matching youth volunteers, and these are aged usually between 16 and 29 years old, with what is sort of considered at-risk children, and these are aged from 6 to 15. So how we, where is the mental health component here is that all our referred youth, they have been clinically diagnosed with a mental health issues, and they have been referred either through child welfare agencies, either to family physicians, schools, and so on. All matches are going through a home assessment process, which are completed by social workers. And as it relates to the mentors, these are recruited from high schools, colleges, universities, and so on. Okay, sorry. I'm sorry about the slides. Okay, so the idea is that the mentors' mandatory training sessions, we also want to make sure that the mentors that we recruit are set up for the challenge. So we are also doing workshops on just a variety of issues to accustom mentors with some of the challenges that might come up within the relation. And these are, workshops on cultural diversities, strength-based mentoring, child abuse awareness, bullying and effective communication, management skills, child engagement, and we also touch upon various other roles such as participants' responsibilities within the mentoring relationships, and of course issues of related to cross-cultural communication. I think this is particularly important because we are located in Toronto, and Toronto has about 50% population of newcomers and immigrants. So we always need to keep the cultural component in mind at all times. Okay, seems like I have some issues with moving the slides. Okay, so in terms of the match, so basically we are trying to match people on common interests. but also, as you know, in terms of convenience, we try to get people who live in the same neighborhood or close neighborhood and so on. So we try to make it as more of a natural relationship that that can be possible. The duration of the mentoring relationship is usually set to 1 year. However, many matches go beyond the specified time frame. And as it relates to amount of time, participants spend an average of 3 hours per week in a variety of shared interest activities. And they also have access to social workers, parent support workers, volunteer support workers, and so on throughout the mentoring relationship. Okay, so what does it mean to have this this anchored within a resiliency framework? So basically, is previously very many. I mean, even Youth Assisting You, when they started in the 70s, they started from this idea of how can we diminish risk and how can we prevent things from happening. And most of these risk reduction programs were focused on the development of effective coping strategies for youth. But as we move forward and new research came up, this idea emerged that we also need to look at the protective factors, because a lot of time with at-risk youth, what's happening, they are managed to develop a certain resiliency. So in a way, they are learning to protect themselves against outside adversity and use that in a positive way. And if we only keep the discourse at the level of, oh, these are youth who are at risk, these are troubled youth, we are tending to miss that component. And that's how we ended up shifting towards a resiliency framework. I will need to change the slide. So the resiliency framework focuses on the individual's ability to, as I said before, navigate basically through life adversities, and to develop the skills to overcome life challenges. And within the literature, a lot of authors have noted this combination of external and internal strengths. So these external strengths will be family, peer support, schools, and community. And the internal strengths usually refer to personality characteristics, empowerment, self-control, and so on. And the idea is that these are the protective resources that youth can make use of to counterbalance risks and deal with stress effectively. Okay, so the resiliency framework is an ecological and comprehensive approach to risk, and basically saying that we have risk factors, but we also have shielding factors, and enhancing one's healthy development and individual well-being. So this is what the enhancing factors are doing. Okay, we'll need to change the slide. And just in terms of, this is just what the literature is saying, that what youth with high resiliency factors are usually less likely to be involved in risk-taking activities, such as substance use and school misbehavior. They're more likely to develop interpersonal skills, self-control, problem-solving, and cognitive competencies, and more likely to engage in constructive behaviors. In terms of methodology, so as I said before, we are just finishing up our second grant year. So within the planning phase, we have developed the logic model, and we have basically tested. Like, we had this idea of how we want our evaluation to look, and we tested it. And we have tested it with 15 mentees. I mean, we aim for a bigger sample size, but what is often happening with, especially in with youth and trying to match, and especially with mentoring programs, it's very hard. I mean, the attrition rates are just always so hard, and this is something that we cannot account or control for. So sometimes we're left to sort of deal with what we can, what we have. As it relates to the full-on evaluation, so this is what we have conducted in 2013. As I said, we moved forward, and we have done a pre- and post-test comparison design studies. And as you can tell, our sample was a lot bigger. We had 100 mentors that we have done the pre-test, 96 mentees, and we are actually able to survey 39 matches, which we think is great. We are currently still continuing this evaluation, which we think this is, one of the positive aspects of like having the chance to do these grants where this is work that we try to keep doing from now on. So as it relates, one of the first thing that we have done in the planning stage, and I think it's actually one of the great things that an organization can do, we have set up a research advisory committee. So we just said, everything that we want to ask for, it's best to have some input from the community, and it's best to have some input from, who participate in the program and parents and so on. So we have set up this committee, and we have invited some frontline service providers. We had program participants. We had some experts within the youth programming field, and then some people from the mentoring field. And basically, we have, so this committee guided the project development all the way through until we got to the full-on evaluation stage. And another thing that we have done with this research advisory committee, we have developed an internal ethics protocol, and we had a committee actually review this protocol because we also wanted to make sure we're collecting our data in an ethical manner, because we're dealing with the risk youth which are already marginalized, so we did not want the research process somehow to produce unintentional further marginalization. So this was the rationale as to why we thought it's good to develop an internal ethics protocol. Now, in terms of evaluation questions, as how Kyle was mentioning formally, we have had process and outcome questions. So the process evaluations mainly aim to shed light on the mentoring relationships and just like logistics and things like that. And the outcome questions were those that actually explored youth resiliency profiles as they particularly relate to their behavioral and social functioning. Now, the full-on evaluation mainly focused on outcomes because this is, we got a sense in our pilot as to like what we should change at the logistical level, but we are really looking for outcomes because this program it's been going on for so long, and this is the first time that it's actually thoroughly evaluated. So we just really wanted to see what's going on. So we had this tool that is called the Child and Youth Resiliency Assessing Developmental Strengths tool. So basically, okay, this is what we have done in terms of methodology in the pilot phase. So we had asked mentees to complete this tool at co-test. And as I said before, we had 50 mentees, and the questionnaires were carried out last summer between June and August 2012. Now for 2013, we have used the same tool, but we have done it, as I said, at intake, which is pre-test, and a 6-month period within the program, which is post-test. I mean, ideally, with the mentoring, we would have liked to have the post-test set up at 1 year, but just because of the timelines within the grant limitation and so on, and like it wouldn't have been possible. So I mean, we're trying to also capture the 1 year, but for now we're reporting on the 6 months as the post-test. And what we have done some qualitative interview with parents, and we also had some qualitative data that we have used. The Youth Assisting Youth providing this scholarship opportunities for mentors, and they have to go through an application process where a lot of them have to share their experience in relation to the program, and we have used that to extract some qualitative data so we can match the quantitative piece. Now, so this tool, we just think, and that's the reason why we went with it, because It has been previously tested for reliability and validity, so we didn't have to do that, so it was sort of easier in terms of just getting something that's already been like, you know, it's good to use. And questions, in terms of the questionnaire items, so it included questions related to external developmental strengths. So as I mentioned before, family support, peer relationships, commitment to learning, school culture, community cohesiveness. Internal strengths such as cultural sensitivity, self-control, empowerment, self-concept, social sensitivity, and core competencies. And I mean, this is like, you know, there's no universal definition as to what these core competencies are or should be. Of course, the developers of the tool have done a lot of research and came up with these core competencies. I mean, we have gotten this tool from Resiliency Initiatives in Calgary from Dr. Wayne Hammond. So he's a very influential person in the field of resiliency. So those conceptually, he developed the core competencies, and as I said, these have been tested. So, but these were basically, you know, emotional competence, moral directness, managing ambiguity, agency, and so on. And we have also included some demographic information, such as age and sex. And this is the summary of participating mentees. So most of them were young males with an age range between 18 to 15 years old. I hope you can get to see the numbers above. Means these are just like demographic descriptives. And as it relates to mentors, we got similar numbers. So you have, you know, like the majority of being males, only about a third of them females. Also 40% were age 19 to 23, and almost half were between 23 and 29 years old. Okay, so in terms of the data analysis, we conducted factor analysis on the strength-related items. And as Kyle was saying, we have also calculated internal reliability with Cronbach Alpha, and we got pretty high scores on them. I'm just trying to. So we basically got, you know, for family, I mean, I didn't put them here, but like I can just tell them. So, you know, like Kyle was saying, like close to 90, it's a good score. So for instance, for the family factor, we got 96. For the community, we got 92. Commitment to learning, we got 88. Empowerment, we got 75, and so on. I mean, we have some with like lower scales too, but these like overall were pretty good. And in terms of the interview responses, we have analyzed this thematically. I mean, we didn't have that many, so we didn't use the software. So I basically have done them myself manually with markers, which I always think the best way to analyze qualitative data is to really get into what people are saying. So now just to give you a little bit of a glimpse on like our results. So we have done youth pre-test, post-test comparisons. So we have noticed like quite a bit of an increase in external factors. So, you know, especially as it relates to the importance of achievement, commitment to schoolwork, family support, and so on. So, I mean, family support, I see here on the slide, is twice. So I'm not sure. I might have been done a mistake there. But on the lower side, we basically have the overall relation with school culture and commitment to learning. And another what was in a way surprising, we didn't expect that, is that the peer influence factor decreased. So it actually, we had a negative effect here, which we didn't think. As it relates to internal competencies, you know, caring sub-dimension, this was sort of expected, it's gonna increase a lot. Youth planning and decision abilities, restraint, social connectedness, youth adaptability, strength-based aptitudes, empowerment dimensions, and so on. And in relation to core competencies, I didn't list all of them here because we have only noticed a positive change on the neighborhood boundaries of dimensions. So this is very, again, this is an area that, like show us, well, like our program actually doesn't address those core competencies from a resiliency framework as well. But as I said before, this is also depending on how these core competencies have been conceptually formulated to begin with. I'm going to touch upon this a little bit later on too, but it's also interesting because where we got the tool from, resiliency initiatives, they are based in Calgary, and I think part of it is when they designed these core competencies, they perhaps didn't cater them to be as culturally adaptive as what we would need for Toronto. So we sort of assume as to that's why we didn't get positive changes on those. And these are some of the parents' interview comments. So, they have also noticed like improved schoolwork, better attitude in their children, development of new interests, and so on. And these are just some of the quotes. So someone said, yes, my daughter was very shy at first and had a hard time trusting her mentor, but the mentor made up for it with her patience, understanding, and kindness. Someone else was saying he didn't change at all at home. The mentor is amazing, and I want my child to be like him, but my son is at fault. He has no desire to improve at home, no desire, no respect. And as I said, we also were able to pull some qualitative comments from the mentors. And what they were saying is that being a mentor has allowed me to view the bigger picture. For example, I now understand the importance of a community, caring adults, resources, exposure to other cultures, and so on. These have helped me to take a critical look at the world, our lives, and to become more humble. Being matched has naturally motivated me to become a better person in order to have a lasting impact on him. That's just what someone else was saying. She showed me that the smallest things are the ones we should appreciate the most. She got me a special Korean spoon for Christmas and told me the cultural story behind it. Although a spoon sounds simple and ordinary, it meant the world to me because she gave it to me from the heart. Little acts of kindness can change someone's day, and mentoring has taught me that giving back to the community is very fulfilling. This is just in terms of stakeholder involvement. So these are just the membership of our research advisory committee. Like, I'm not going to insist on each name, but you can see that we have inclusive membership. In terms of knowledge exchange, we really think our forte is here. I mean, we had the final report delivered to the Ontario Center of Excellence. And what we have done last year, and we are again doing it, we're in the process of doing it this year. So last year we have wrote a very short community report on the pilot results. And we just think this is a great way of having something, palpable as to document our findings. And right now we're also in the process of doing another report on the full evaluation data. And we're planning to disseminate this report among organizations and so on. And we're also trying to, as I said, we're still collecting data. So we're hoping to go ahead and write a journal paper on the outcomes later on. And then, yes, I guess we can. And in terms of capacity building, so we just basically, it was so great to have this grant, because we just really realized a lot of things. Like, we realized, okay, like what type of resiliency framework we want to move towards. We just realized, well, we really want to develop a cultural piece. We also, it was great to just, like, we feel like we really developed our community partnerships a lot more. And then we have increased our capacity for sharing the results also with potential funders and partners. Challenges, as I said before, we had high rates of volunteer attrition. I mean, this is it's sort of how, like, I mean, I'm sure if a lot of people do community research, and especially in a mentoring program, it's like you cannot really control for that. It's just, it's so easy for this relationship to break down and then, like we don't have those people in the sample, so that's a real challenge. And in terms of the parental feedback, I mean, we wanted to use a standardized tool to administer with parents. So initially we tested the child behavior checklist, and it did not work. I mean, it was just so, I don't know, it just did not work with our clients. The family assessment measure we have also tried, but they also did not work. Like, we feel that none of these tools didn't correlate with what we assessed in terms of resiliency. Another challenge was the timing. I mean, timing is unique to each child. And like, some relationships actually end before the 6 month mark. And another challenge was the cultural barriers, the special needs and special language, because we have about like 45% of our served families are newcomers. So it was hard when we administer the tool because of language barriers. Also, the length of resiliency questionnaires. I mean, this initially had 130 items. We managed to drop it to 83, but it's still too long. I mean, sometimes it takes us like 1.5 hours to administer, which is just way too long. Especially we're working with youth, and they just don't have the patience. So the idea is, we are now in the process. I mean, once we want to still collect more people in the sample for our journal paper, but once we get to 100, we want to move to a different resiliency perspective, which is from out east, led by Dr. Unger, and we hope to administer a shorter version of a tool. And this is just, like, we had some scheduling and administration of the tool issues, and then we also had some problems with the data collection software. And I still remember in October, right before we had to submit the report, I mean, 2 weeks before, we lost so much data. Somehow it didn't get saved, and we had to like re-entry manually everything. So that was not a fun time to do, but it can happen. And then limitations. I mean, in terms of our limitations, we're always going to get a skewed sample because we only have access to the youth who are referred for seeking services. So therefore, like, these youth, we can't say they're representative for all at risk youth. And another thing is, like, we are relying on participant self-reports. Again, we have high attrition rates, which is a limitation, and we didn't really had qualitative findings from NTs. And this was also part because it took us so long to administer the tool that we just like felt that it's not ethical to us participants to also like provide us with an interview and so on. And yes, I think that's all. I'm sorry I like rushed a little bit towards the end, but I think I'm a little bit over my time anyway.
No, not a worry, Raluca. Thanks for that. I love that it really touched on a lot of stuff we mentioned, and that you went over a lot of the challenges and stuff that came up along the way, but how you adapted to them and kept moving forward. Thanks for that. I really enjoyed that. So just to do a bit of a wrap up here, if anyone's interested in learning more information about this webinar or topic, the webinar is going to be posted in the archived learning events on the center website. It's usually up in about 1 to 2 weeks following, but we'll send everybody an email to let them know when it's up on the website, and you can just click add there. If you want to contact either Raluca or myself, I provide our email addresses here. Be sure to follow the center on Twitter at CYMH_ON to keep in the loop about all kinds of events and learning stuff that we have going on. Upcoming webinars, so later on this month on the 18th of February, we're starting the first of a 3-part series on working with data, starting with collection. How do we gather it? The center's Catherine Thompson is going to be hosting this webinar, joined by Chloe Frasina and Chris Evans from Good Shepherd Center in Hamilton. And on the 4th of March, the center's going to have part 2, which is data management. Now that we have the data, what do we do with it? And that's going to be hosted by the center's Alana Smith and Tara McFadden. Just a quick reminder to everybody that you will be getting an evaluation survey for this webinar. I ask that you please take the time to fill this out. We use this feedback to improve these webinars and to see what we can do better and how we can offer different webinars in the future. If you could take a few moments to fill that out, that would be great. And that wraps up all the formalities, so we can just open the floors to questions. I don't have any myself for Raluca. You did a great job at answering them all for me during the presentation, some that I had. And just a reminder to everybody that if you do have any questions or comments, you can submit them electronically via the question box on the control panel, or just use the raise your hand button and we can switch to you verbally. Okay, so one thing that I did want to ask for Luca while I have you on the line is I love the bit about when you said that we were looking for other measures that didn't correlate. Were you able to find ones that were better fits for the data that were able to help you, or what was sort of the process around that?
No, well, in terms of, we initially, I mean, we're still on this idea that we want to use parents' feedback as an indicator for the youth's sort of success. But the thing is, I mean, when we have administered the CBCL, it was very medical, and it looked like, it's just, the results should just fit into like a DSM manual. So we just didn't think, because we're trying to not, we try to move away from this this perspective of, like putting people that is something wrong with them, and we felt that that tool would just like reinforce that. And in terms of the family assessment, like the same. It just like it just didn't fit. We didn't think. It's a good fit, and we just didn't really know where else to look for parents tool other than that, and that's how we end up saying, okay, so let's just go qualitatively and just ask for feedback in like small interviews.
All right. Well, no, that's great. I love hearing that, and that seems to be a thing that I'm picking up on, moving away from that sort of disease DSM type thing, and that you dove right into the qualitative data. I think that's great. So I'm not getting anything coming in, so I think we'll wrap up the webinar. Feel free to send in any questions if you pause and think afterwards of anything that comes up, and I'm happy to answer them as well as Raluca. I'd like to thank everyone for, oh wait, we do have a question coming in.
It's from Adrian. Adrian, can you hear us? You should be able to speak now. Oh, your mic isn't working. If you type the question into the questions box, we can read it out loud for you. We'll wait online for a few more minutes for you to type in your question, Adrian, but for those of you who aren't able to and have a 2 o'clock hard cap, thanks very much for participating today, and we look forward to seeing you at the next webinar. Oh, and we... So we have a question, and it says, just a question on qualitative software. I've used In Vivo, and I was wondering if anyone had used any other qualitative software to do qualitative research.
I can just jump in with that. I did not use it yet, but I am about to use MXQDA. It's not very popular, but apparently is a lot cheaper and a lot better than In Vivo. So that's what people are saying. But I did not use it yet, but I have it basically installed and ready to use at some point.
All right. Well, thanks for that, Raluca. At the center, we use In Vivo, so we don't have to use it too often, but that's the one that we're familiar with. I believe the center does have a data kit on qualitative methods, or a mini kit that will be coming out soon. So I'll pull that and put together some resources that we have and send those along to Adrian and see if there's anything there that can help you out. Let's go back, and if there are no more questions, we'll wrap everything up for the day. Thanks for joining us, and sorry for running a bit over. Thank you again to Raluca for joining us, and thank you for that presentation and being so informative for everyone. And everyone, thank you for joining, and we'll see you next time.